This is a very emotive topic with regards to the refusal of transplants in some countries, not everywhere, for people who were unvaccinated after the recommendation had been put out that everybody who was receiving a transplant was encouraged to get the vaccine. It's important to note that, as I said, this is not an international standard. As in some places, they clearly say, even though they encourage people to be vaccinated, they don't require it for transplants. But it came to my attention again, and largely because I saw an interesting point with regards to this case. This occurred in Canada, and this is about a patient from Ontario who died after being denied a kidney transplant based on his vaccination status. And this was published in July of 2023, so it's not recent, but it came up again, and I thought it was important to address this and look at some of the issues around the science. And his wife was very upset because they were actually asking about whether or not he'd be willing to donate other organs to people who needed transplants, even though he had been denied one. And that, of course, you can imagine was very upsetting for his wife. So overall, a very sad situation, and one that it's disappointing that we had to even come across. I've got here, just so that you're aware, certainly in the UK, this is Kidney Care UK and COVID-19 vaccines. They encourage all the vaccines because they have passed all their stringent safety tests. They highlight that people with kidney disease on immunosuppressants may have weaker responses to the vaccines. Important to note that if someone has a kidney transplant or any transplant, they're often on lifelong immune suppression. And after the vaccine, people at highest risk may want to continue to follow some precautionary measures. So that was the point in terms of the UK. But I thought that I would highlight something very specific that they said in relation to transplants on the vaccines. And here they pointed out how long after should you have the vaccine after the transplant, and should I have the vaccine if I am waiting for the transplant? They said yes. And then this is the big question: will I be taken off the transplant waiting list if I have not had the COVID-19 vaccination? And they highlight here that false reports have been circulating that individuals will be taken off the transplant waiting list. This is not the case. And as I said, so this is the issue in the UK, but it's not necessarily the same across the world. A similar thing, I think, happened in Australia as it did in Canada. The USA, depending on where you are, could have different rules in relation to transplants. And one of the interesting articles here that came out here was, should patients be required to receive a COVID vaccine to be listed for kidney transplant? And this was published in January of 2024, again looking at this point. And they were highlighting that there already been so many doses of COVID vaccine. 590 million doses have been given out. 222 million people were fully vaccinated. And what he had highlighted in there, he pointed out that, so why should a person in need of an organ transplant be required to get a COVID vaccine to be listed for a kidney transplant? There is no real solid data that can support the need to be pre-vaccinated before being listed as a candidate for transplant. And this was the situation, as he thought in this paper, up until 2024, January of 2024. In reality, I think that the more recent research that has been coming out, and this is where I explain to people that I'm not following a narrative in terms of the pandemic. I am really trying to stick as closely as possible to what is the science, what is the benefit, what is the risk, because you have these camps. Some people are very much pro vaccine, and as far as they're concerned, there can be no negative impacts from it. I'm not in that camp. I'm very willing to challenge anything that is going on. And anyone who has listened to me will know that. And then you have another cohort of people who are very strongly against the COVID vaccines, where they don't believe it has any benefit whatsoever and has been a tremendous disaster across the world. I am not in that camp either. I am in the middle. I'm in the middle where I look at what were the benefits, what were the risks. And I think in terms of transplant patients, this is a really important point. This is a paper that was published in November of 2023, where they were doing what we need: comparison of outcomes in vaccinated versus unvaccinated COVID-19 kidney transplant recipients. It was just a single center, and this was done in Ohio. So in the United States, clearly they didn't have a policy that required people to be vaccinated, and so therefore they were able to look objectively at what were the outcomes. And that's where I said you really have to put on the scientific head. And here are the outcomes based on their single center looking objectively at the data. I think there are about 400 transplant patients. And when you look at this, they are comparing the vaccinated cohort to the unvaccinated cohort. And they had 282 people in the vaccinated cohort and 118 in the unvaccinated cohort who had a kidney transplant. And you can see here, in terms of them being COVID positive, 33% who were vaccinated were COVID positive compared to 39% of the unvaccinated. So a slight increase in terms of if you're unvaccinated, not surprising, you had a slightly higher risk of getting COVID. Important to therefore highlight, just in case there are people who don't quite understand, the vaccine does have an impact on infection, but as you can see, it's not a huge impact. It is just somewhat of an impact. And again, when we go back here, again, when you're looking at the outpatient management and looking at ICU admission for COVID 19, this is an important statistic. 1%, so 3 of the 282, ended up in intensive care compared to 3.3% of the unvaccinated. Now, before I go any further in it, I think it's important to highlight an important point about this data. And so that you have the objective analysis here, is that this was collected between January, between the 1st of February 2021 to the 30th of April 2022. That's important because in that period of time, we had the Delta wave in the late 2021, which was very severe, especially for the unvaccinated cohort with comorbidities. And so, in that cohort, especially with kidney disease, they would have been at higher risk of severe disease. And this is where I said you have to look objectively at the data in order to understand. So it's no surprise that when we looked at our research, we have always highlighted that it's likely to be tied to the levels or the levels of serum ACE2 in the bloodstream that leads to severe COVID 19 or is associated with severe COVID 19 and an autoimmune response. Kidney disease, because it's filtered out in the kidney, you almost always have elevated levels of serum ACE2 in patients who have kidney failure. So just based on that, I would expect that cohort to be at high risk for severe COVID-19. And this is when I say you have to get very practical. If you have a high risk person, then yes, you should encourage them, certainly at that period of time, to have been vaccinated. The problem comes is that that period of time where you had high risk and you had limited exposure to the virus, they have extrapolated that thinking to mean, therefore, that everybody, therefore, would benefit, say, from boosters up to the 10th or the 12th. I'm definitely not in that camp of being far more critical in looking at where the benefits lie at this point. But certainly between 2021 and late and mid 2022, when we still were having the waves in somebody who was high risk, absolutely made perfect sense. And as you can see, again, looking further, you can see here length of stay in hospital was about equal. All cause mortality, a very important measure, so it's not just about COVID, was still lower in the vaccinated cohort versus the unvaccinated 4.6%, 5.93%, and higher risk of COVID death in the unvaccinated 2.5 to 1.7%. But critically, graft failure percentage remained stable across both cohorts, 4% and 4%. And so overall, when you look at that data, you would then be able to extrapolate that if you're not seeing a higher risk of rejection from the transplants with regards to being COVID vaccinated, and a lower risk of severe disease in someone who was going to have a transplant, yes, you should encourage them, but not mandate them to have the vaccine. Invariably, you have people who, even after you've looked at the science and you've encouraged them and you've told them what's going on, they would say, listen, under no circumstances would I want to have mRNA. Now, that's, you have to accept that, because we see this all the time. People who smoke, people who drink, we don't reject them from treatment because of their choices. What we do is try and make the education and give them good informed consent. But critically, one of the points that I think many people forget is what I call the nocebo effect. If for whatever reason you have someone who has a very strong negative view about something, it doesn't matter what it is, a tablet, an injection, a vaccine, if you force them to do it, you increase the risk that they will have negative effects from it, simply because that's almost what you call the mind over matter effect, where they are more likely to have a negative outcome simply because they were forced to do something against their instinct and their natural will. So it should never happen, in my view, in clinical medicine. Always encourage people, but never force them. So, in the conclusion of that presentation, I would say that I would be encouraging people, certainly at that time, if they were going to be going for a transplant, the risk of surgery, the risk of anesthetics, the risk of long term immune suppression. There's so many risks associated with that, that adding that one extra bit would, in practical sense, make perfect logical sense to someone going for a transplant. And so that may have been why some countries went to the extreme of mandating it and refusing to do transplants if somebody didn't have it, which I don't agree with. That's unethical from my point of view. But the science does support that this high risk cohort at that time would have benefited from the vaccine. So that's the conclusion that I have. And as usual, I will encourage you to continue to support us with regards to Disease X. As you can see, today we are still number one in microbiology science. We've had now 2 5-star reviews. Please, if you've read it or are reading it, we really need those reviews. It certainly helps it on Amazon. So we really appreciate the support so far and would encourage you to continue to join with us in understanding the science. Have a great evening, and we look forward to sharing more valuable science and information with you in the near future.